Clinicals. What are clinicals? Well, nursing school clinicals are a type of learning where nursing students have hands-on experiences in actual healthcare facilities under the supervision of an experienced nurse. Students apply their classroom and lab knowledge and their skills during the clinical setting. Clinical rotations will provide a variety of opportunities in various healthcare environments for students to learn how to care for clients. Clinical experiences start with the skills lab, where students learn the skills that are required to care for their future clients. Clinical experiences in facilities begin slow, often in long-term or rehabilitation care facilities, and this will allow students to kind of ease into patient care as they learn to begin working as a nurse. In other words, we kind of start you slow for the first few clinical experiences, then we ramp it up. You're going to be practicing as a student nurse in the facility. As a student, you're going to be liable for your own actions. Your instructors are not liable for your actions. They are only liable for the information they give you and for appropriate supervision. You will only be able to do those skills in which you have been properly checked off on in the skills lab. If you're unsure whether you can do something in the clinical situation, always verify it with your instructor. If you can't make contact with the instructor because they may be in with another student or they may be in a different area, you can always observe until you get that clarification. So never just go ahead and do it. You always need to get the clarification first, but observing, you can still learn a lot. Performing skills or tasks in the clinical facility that you are not qualified to do could result in disciplinary action up to and including dismissal from the program, because this is putting actual patients in harm's way. You can cause harm to a patient by doing this. Students are expected to follow guidelines for professional behavior that are established by the college, the department, and the clinical facilities. And failure to follow the policies of these entities can result in disciplinary action, again, up to and including dismissal from the nursing program. Examples of some of these issues could be leaving the facility, and this includes going to your car or outside the building unless you are accompanying a client, smoking at clinical, sleeping at clinical, or not being actively engaged in client care or clinical work as assigned by the instructor. At clinicals, do not interrupt the nurse reports for clarification. We're visitors. We're just observing. We are not intimately involved in that nurse report. If you need clarification, talk to your instructor. Do not sit at the nurse's station. There's a limited amount of seating available, and that is provided for the nursing staff. Do not sit at any time during clinical, except when you're performing tasks that require sitting, such as maybe assisting a client to eat, visiting with a client, or during one of your breaks. You always stand to review medical records. We do not take medical records away from the nurse's station, so that means that you're standing at the nurse's station to review medical records. Do not argue with the facility staff. Again, we are visitors. We do things their way, and we do things as they want or need them done. Do not leave the unit without letting your instructor know where you are. Always stay busy. You can do this if you don't have anything personally to do by helping your classmates, helping the UAPs. Shadow a nurse, but don't get in their way. Visit with the clients, especially in these long-term care facilities. They have some amazing stories to tell. Follow a client to a procedure or a therapy with the instructor permission, of course. We always act with professionalism. And once again, we always let the instructor know if we need to leave the unit with our client or going to the bathroom, etc. Again, remember that we are visitors at the clinical sites. Your behavior and actions reflect not only on you, but they also reflect on the college, and they can affect the college's ability to continue at the facility. If we do not have clinical sites, then we cannot um, have a nursing program because those clinical hours are required by the state. So you're not only hurting yourself, you're also hurting future students. Clinicals can also be a form of a job interview. Many of our students have been offered jobs directly at the clinical sites. Student versus work. This is kind of a touchy subject because we know that a lot of our students have to work in order to make ends meet. But we also need to understand that even if you are allowed to perform certain tasks at your work site in your current role, whether it's uh, medication aid or um, some type of a tech, but you have not checked off on it at school, you cannot perform those skills or tasks when you're at the facilities as a student. So even if you do it at work, you've been doing it for years, if you've not checked off on it in your skills labs, then you cannot do it as a student. And it applies in reverse as well. So even if you are able to insert a Foley catheter as a student or start an IV as a student, you cannot do those things at work. You have to verify with your employer if you are able to perform those tasks as an aide or a tech. So it does not give you carte blanche to do things um, in all situations. Clinical attire is very important. It has to be worn at all times, whether you are in simulation, whether you are in the skills labs, or on the clinical sites. And this means whether it is on ground or virtual. First of all, we start off with that KCKCC ID badge and the student badge buddy. They have to be worn above the waist, and it is part of your uniform. It has to be worn. Your hair has to be neat and clean without extreme colors. In other words, we do not allow colors that are not naturally, um, that don't exist in nature. To avoid contamination, hair needs to be controlled so it does not fall over the eyes. Long ponytails need to be pinned up to avoid falling into work areas. And trust me, these are also things that confused clients can grab a hold of, and trying to pry their fingers off can be very, very painful uh, for the person whose hair is being pulled. Facial hair has to be short, clean, and well groomed, and must in no way interfere with the technical and professional requirements of a nursing student's work assignment. So any hair. Personal hygiene and cleanliness are required. This includes using deodorant and brushing their teeth. The instructor does have the right to dismiss a client from clinical or simulation or skills lab if clinical attire is not appropriate. So if we see a deficiency anywhere, whether it's personal hygiene or the attire itself, or fingernails or makeup or jewelry, etc., it's going to be we can dismiss you, and it will be classified as a clinical absence. We also discourage perfumes, colognes, and scented toiletries. Some clients have very adverse reactions to scents, up to and including nausea, vomiting, just because of different odors or aromas. Fingernails need to be cleaned, well groomed, and no longer than a 1/4 inch from the tip of the finger to the tip of the nail. Artificial fingernails include bonding tips, wrappings, acrylic, gel finishes. We do not allow those because these harbor bacteria. Any fingernail that you were not born with is considered artificial and may not be worn by healthcare personnel who provide direct patient care. Nail polish also should not be worn. It is not allowed. Makeup should be conservative and in good taste. False eyelashes are not allowed. Jewelry and body art. You need to have a watch that has a sweep second hand. This is required in order to count respirations, to count heart rates, etc. You can wear a wedding band. It should be plain, it should be very simple, and it should not have raised stones. Those raised stones can trap microorganisms, and they can also injure the clients. One set of simple post earrings is allowed only. You can use flesh or cleared spaces or spacers in other piercings or gauges. If you're wearing a post piercing in the ear for alleviating migraines, in other words, those daith piercings, the sum total of ear piercings may not exceed 3. And we may require a doctor's note for wearing of a daith piercing. No tongue rings are allowed. Body art has to be covered as required by the clinical instructor and facility protocols. Undergarments are required, although we're not going to be checking, but they are required. At the same time, they should not be visible. Uniforms should be clean and free of wrinkles. In other words, don't pick up a scrub top that has been lying on the bed, all crumpled up, pick it up and put it on. It needs to be free of wrinkles in addition to being clean. You do need to order your scrubs from Merides Uniforms, and information has already been provided to students with the acceptance letter. The shirt will be embroidered with the KCKCC logo. PN students will have red scrub tops. ADN students will have blue scrub tops. Everyone has black scrub pants. These scrubs need to fit appropriately. They should not be tight. They should not be binding. We do not need to see cleavage, and this is cleavage in the front and cleavage in the back. It is optional. You can wear a solid color black or white knit top under your uniform, but it should not be visible below the hem of the scrub top. And the sleeves must be able to be pushed up above the elbows. Some people get cold in these clinical sites, and those long-sleeved undershirts can be very, very beneficial. The pants, again, are going to be a black scrub pant. They have to fit appropriately, loose-fitting, non-binding. They need to be shoe top length, and again, no back cleavage. No jeans, sweatpants, or leggings are allowed as part of your clinical attire. Shoes have to be clean and closed-toed. No sandals, no clogs, no heels, no croc-like shoes, or shoes that are permeable. In other words, they need to be waterproof. You would be amazed at some of the things that get spilled on our shoes, such as blood and urine and feces and vomitus. So you don't want that soaking through your shoes. Face masks, eye protection, follow the requirements that are set forth by the Wyandotte County Health Department, the clinical facilities, and KCKCC. If you do wear face masks, they need to be plain with no writing, no graphics, etc. And miscellaneous. Each student is required to bring his or her own stethoscope and pen light for assessing patients, to clinical, to lab, and simulation. You also need to carry with you, and this is a pet peeve, you have to have pens. You have to have a pen. Around the mannequins, pencils. You need to have a permanent marker to mark things like dressings. You need to have scissors, preferably bandage scissors, but not required that they are bandage scissors. Again, that pen light. You need to have some kind of paper in your pocket, and this is why we provide a small spiral notebook for you to carry in your pocket. Hemostats are not required, but let me tell you, they are one of the nurse's best friends. On-campus clinicals, often referred to as skills labs, will provide you a safe place to learn and practice skills without having to worry about harming a live person. Once a skill is reviewed in the clinical lecture, you can then perform it in your checkoffs. Make sure that you use your time wisely. If you're not checking off on a skill, you should be practicing or completing an assignment per instructor discretion. Being able to successfully check off on a skill does not mean that you're competent in that skill. All it means is that you practice just enough to be able to successfully check off. Competence is only obtained with practice and experience, and competence can take months to years to accomplish. Practice helps develop muscle memory. In other words, you're able to do it without thinking about every little step that you have to do. How do I hold the arm? How do I do this, etc. Students need to be able to properly complete each skill every time without mistake or looking at the checklist to be considered even partially competent. A failure to practice, even after a successful checkoff, can actually run the risk of harming your potential clients. Limited lab time is provided to accommodate our schedules, so we also provide what we call open labs for additional practice. And we do encourage you to attend open labs. Be prepared when you check off. This is not the time to be asking questions or techniques. Your instructors are going to coach you during practice, but they're not going to coach you during checkoffs. However, be assured that when you are at a clinical site and you're getting ready to perform a skill, that you may receive some gentle coaching at that time from your instructors. During checkoffs, make sure that you actually complete the activities that are associated with the skill. This includes hand hygiene, etc., unless you've been instructed by the instructor to not do something. For example, during IV labs, we do not want you to be actually flushing all of that saline into the mannequin arms. Always make sure that you follow the nursing process in order. Make sure that you assess before you intervene. Treat the mannequins as real people. Your instructors are going to be watching you, but they're not really there, so you shouldn't be asking them any questions during your checkoffs. Always be prepared. Make sure that you read the material you need to, watch the videos that you need to prior to coming to Skills Lab. If you feel like you've made a mistake during a checkoff, you can always start over. And if you have made a mistake and you realize that after you've already gotten all the way through the skill, just make sure that you tell us what you did, what you should have done, or how you would have corrected that mistake. Even though we're only working with mannequins, you cannot break sterile fields. It has to be done correctly. Everyone will have to purchase a skills pack, and this needs to be brought to your on-campus clinicals or your skills labs. Make sure you will be using all of those items in your skill packs by the time the clinical course is completed. All students are going to be required to help keep the skills lab clean. Clean up after yourself. All mannequins should be carried by 2 people if they need to be moved for any reason, and all mannequins should be returned to the original spots at the end of the day on those on-campus or clinical or skill days. All mannequins should be covered, the beds neatly made, supplies put away prior to dismissal. Never use betadine or ink on or around the mannequins. So make sure that you do not pull out the pins, that you have the pencils around the mannequins. And also make sure that you remove all tapes and all dressings from the mannequins after you've checked off. These, unless your instructor tells you to put it, leave it there for the next student. The adhesives become very sticky on the mannequins if they're left there. Social media policy is very important. Nursing students should adhere to the college's social media and network usage policies with an additional responsibility to follow HIPAA regulations. Failure to follow these policies can result in disciplinary action up to and including dismissal from the nursing program. And I want to tell you, if you start posting things on social media, someone's going to see it. You will not get away with it. Um, Someone always sees it. No photos should be taken of any staff or clients in any clinical setting. Photos and or comments should not be posted to social media that refer negatively to the nursing program or any of its components, and this includes the clinical sites. Photos and or comments should not be posted to social media that includes the name or any identifying features of any clinical site. No camera devices are allowed to be used at clinicals. Tablets or computers can be taken to clinicals if allowed. Do not take pictures of yourself, your friends, your patients, or anything at all at clinicals. If this is done, you can actually be dismissed from the facility for a HIPAA violation, and this is a legal issue. In on-campus clinicals, compromising pictures should not be taken of the mannequins. If you need to look something up, there are a wealth of resources in the clinical facilities. Some clinical instructors will allow you to carry your phone if it has some of your reference material there. If you need to look something up, look it up. It's something that you would be doing at your job site if you needed to. Facebook is a very touchy subject with regard to clinicals. Again, no pictures of any kind related to clinicals are allowed. And it doesn't matter if it's Facebook or Instagram or any of those other um, social media sites. You need to be aware of what you're posting because it will be found out by the instructors and it can result in consequences. Make sure that all posts are professional and you avoid inappropriate content and language. Don't forget that all this content is accessible by future employers. In fact, they have staff members that actually will search out social media sites of any of their job applicants. So keep in mind what you want future employers to read as you're making your posts. Make sure that you turn cell phones off during clinicals. Even on vibrate, it can be a distraction. Only leave it on with instructor permission. HIPAA, which is the Health Insurance Portability and Accountability Act, regulates client privacy and confidentiality, and you will be learning more about this as you go through the nursing program. It includes clients, students, staff, faculty, college, and stakeholders. So privacy has to be afforded all of these entities. HIPAA violations includes sharing of client information or pictures. In client facilities, you can only access information that pertains to caring for your assigned client or per instructor direction. All confidential client information is to remain within the institution. You cannot remove confidential information from the facility. You cannot photocopy client information. Clients are referred to only by their initials on clinical paperwork. Anyone who is not involved in the direct care of a client has no right to clinical information. Medical records should not be left open. Computers should not be left pulled up to a client. You should always sign out. And you should not talk about clients in the hallway, the elevator, the cafeteria, etc. Nursing students will not use social media either at school, home, or work to violate patient safety and confidentiality. You are restricted from posting photos of clients and/or client identifying information. You cannot use social media to violate nursing student handbook, harass stakeholders, and this includes the students, the faculty, the staff, the board of trustees, etc., or in any way defame or disparage the college. Violation will result in disciplinary action, including but not limited to immediate dismissal from the program. And again, I want to reiterate that HIPAA violations is not just a college thing. This is a facility thing, and it is a legal issue. You can suffer legal consequences if you violate HIPAA. And some last minute thoughts. You are responsible to have all the required items that you need at clinical. It's not someone else's responsibility to make sure that you have such and such. And it's your responsibility to read the handbook. Read it again. Ultimately, you will be responsible for all the information that is located within it.